if you think of your pelvis as like a bowl of water,
Yeah.
right? If I were to stand and dump out all the water, right, you have a forward tilt to the pelvis. That also can happen when the rib cage would flare. Okay, and we call it an open scissor posture. So when I'm assessing these patients, I'm looking at, can they stack their rib cage over their pelvis? Do they have good breathing patterns? Can they breathe 360 degrees around their belly? Can they expand their rib cage? Because if they cannot do those things and they stay in this posture, if you were to stand up and dump all the water out, tell me what would happen to your feet.
And this is where pronation gets a bad name.
Yes. In genu valgum, right? Everybody's in, don't let your knees knot. I'm like, tell that to a hockey goalie who stands there for 3 periods in a valgus position at the knee. I don't believe there's any bad posture positions. It's only bad if you can't control it and you can't get out of it. You have to be able to do these things. I have to be able to protract my shoulder. I have to be able to arch my back. You just better control it and be able to get in and out of it.
Because it's not a conventional view. It's not a mainstream PT view, and I'm not throwing PT under the bus. It's not a mainstream anybody view. And yet I've heard it enough from the people who I think are hands down the best at movement that we should reiterate the point. There isn't a bad posture per se, but control is what matters. And you could argue that the best movers on the planet frequently engage in what would be viewed as quote unquote bad posture.
Yes.
First off, let me say I am a fan of Peter Attia, and I am a fan of Dr. Connolly and most of what she publishes with Gait Happens. I think we agree on about 90% of everything. But that only made this 2 minutes of video harder to watch because these two individuals use such unscientific thinking to dismiss something that is very well supported in the research. Let me explain. Number one, Dr. Connolly starts with talking about assessments that are not reliable objective outcome measures. You can't say rib expansion unless you're going to measure it with a measuring tape, rib flare, or being able to stack the ribs over the pelvis are reliable objective outcome measures. Those are things that you might visually identify as a clinician, but their inter-session reliability, let's say, is going to be not so great. And you definitely can't use it as a continuous interval measure to track progress. They then go on to dismiss something that we can reliably assess, which are several signs of postural dysfunction. Further, Peter Attia uses an appeal to authority. The best in movement. Don't believe that. That's not scientific thinking. You guys have heard me say several times that I don't think expertise is enough anymore. It is either research-supported expertise, or we probably need to move on. And in the case of postural dysfunction, there is a ton of research. So where does this discussion start to go off the rails, and why are there so many myths right now around this idea that posture is not correlated with pain and dysfunction? Well, it starts with a lack of an operational definition. And it's not actually that we don't have an operational definition, it's that people replace an operational definition with their belief of what posture is, making it something easy for them to attack so that they can dismiss it. But the truth is there's a long history of correlating posture and patterns of posture with pain and dysfunction, going back to names you've probably heard like Kendall and Yonda and Sarman and what NASM did with corrective exercise, and of course what the Brookbush Institute has been doing. Now, I have been using a historically developed definition for more than 2 decades in teaching, and that definition of posture would sound like this. Arthro and osteokinematic alignment maintained by myofascial activity and length as a result of sensation integration and activation by the nervous system, both statically and dynamically. For example, good form is an example of ideal posture for a given exercise. Now, I've gone one step further in recent years to create a research refinable and measurable definition of posture, and here's that definition. A mean range of segment alignment that is absent of signs correlated with dysfunction, pain, or an increased risk of injury. Now, the reason I know that there was no operational definition set up in the 2-minute video we just watched is because Dr. Connolly spends a lot of time talking about things I would call postural dysfunction and addressing them in a way similar to the way I would address them. So we agree on a lot, which makes her dismissal of the idea of posture that much more disastrous. Let's talk about why saying there's no such thing as bad posture is like saying there's no such thing as bad blood pressure, right? When we talk about signs of dysfunction, signs of postural dysfunction, what we're actually talking about is somebody exhibiting a sign of dysfunction during something like an overhead squat assessment that is low intensity enough that somebody should be able to perform the movement optimally. And any sign that is exhibited is probably a sign that that person is adopting that compensation pattern more often than optimal, which is increasing their risk of pain and dysfunction, or is maybe correlated with their current pain and dysfunction. Blood pressure works a similar way, right? Our body has different variations in blood pressure, but we wouldn't say there's no such thing as bad blood pressure. And what we are actually stating is when somebody is in a calm state, we know that blood pressure should be somewhere around 120/80. If someone came in with 180/120, we'd go, okay, wait a second, something's going on here. And postural dysfunction kind of works the same way. If somebody does an overhead squat assessment and their feet flatten, turn out, and their knees bow in, this is just a bodyweight squat. If they're doing that during a bodyweight squat, what's happening during intense physical activity? Obviously, this is going to lead to an increased risk of pain and dysfunction. And part of the problem with this 2 minutes of video is that scientific thinking about the problem is completely ignored, dismissed with an appeal to authority, right? And then cherry picking athletes, right? The statement that was made was the best movers or the best people in movement science think that there's no such thing as a bad posture. We see even great athletes show signs of bad posture. That's like saying, well, the best physicians I know don't even take blood pressure anymore because, even great athletes have high blood pressure. Yeah, that might be true. But just because some athletes have high blood pressure doesn't mean it's not a problem. And when we talk about the research, there are tons of research studies to demonstrate correlations with signs of dysfunction. So what does the research say? Why am I so mad at this appeal to authority that the best in movement science say that posture is not related to dysfunction, or there's no such thing as a bad posture? Well, there's dozens of studies that actually show that several signs that I would call postural dysfunction, based on the definition we just discussed, are correlated with either current or future pain and dysfunction. This includes things like pronation, knee valgus. There's even some on feet turnout and knee varus. Things like an excessive forward lean, rounded shoulder posture, forward head posture. There's dozens of research studies demonstrating a correlation. Now, remember that a correlation is a mathematical strength of a relationship. Now, when we have this much research to go on, it gets a little frustrating because when people say that posture is not related to pain and dysfunction, they haven't read the research. Not only do we have research correlating these signs of dysfunction, we even have research showing that addressing some of these issues reduces pain. We have some research showing that, you can actually decrease the risk of injury with corrective interventions. That's injury prevention, right? I don't know how else we need to attack this problem, but it sounds to me, looking at this research, like this is a great thing for us to address as clinicians. And when I heard Dr. Connolly say things, well, like I look at the expansion of the rib cage and rib flare, which is not a reliable outcome measure that has been correlated with anything, or the ability to stack the ribs over the pelvis, which again is not a reliable outcome measure. I don't actually care that she's using those in her clinical setting, right? Clinicians observe all sorts of things that can be helpful. My problem is dismissing something that the research has shown to be reliable and replacing it with something that isn't. This whole idea of contrarians dismissing one evidence-based intervention or assessment over and over again, and then replacing it with something that isn't supported is a problem in our industry. I just really wished in this video that Peter Attia and Dr. Connolly were just a little more careful in dismissing something that has almost 100 years of development behind it and can be so helpful for so many individuals. So where do we go from here? Well, I can tell you guys, don't throw posture out. Posture is just mean segment alignment. What does optimal motion look like? That's essentially the definition of posture. If you have an idea of what optimal is, now you can identify signs that deviate from optimal. And if we can identify signs that deviate from optimal that are correlated with symptoms or dysfunction or pathologies, then we can create reliable interventions to address those signs, which can now also be assessed reliably. And then we can reassess to see if we improve, and we close this circle on our way to an optimal approach. Right? The idea is to get the best possible outcome. And dismissing things with appeals to authority and cherry-picking athletes, man, that's just, I don't know. I don't know what else to say. This was just, it was like watching two people I like just kind of like their brains fall out, and it happens to all of us. But man, this 2-minute video, oof, or this 2 minutes of video, rough.